This is a couple ways, or I guess a couple different reasons why females will report more low back pain than males. So reporting, men don't like to admit they're in pain. That's the simple truth. How's it going, everybody? It's Dr. Nick here at Kalkstein Chiropractic, your Baltimore area chiropractor. We're here with Kaylee today, and Kaylee's gonna be asking me some Q&A questions. Take it away, Kaylee.
Okay. What should you do after a tailbone injury to minimize pain?
Good question. I'd say that the biggest thing you should do first, depending on how you injured your tailbone, is to get checked by a professional. Make sure nothing's fractured or broken or anything like that. And afterwards, depending on who you see, a lot of I guess your entry of care professionals, your primaries, stuff like that, they're gonna do some sort of pain reliever, analgesic, and potentially, depending on the significance of the injury, they might get you a little cushion to sit on.
Little donut.
Little donut. But if you come to see us here, we'll make sure everything's good to go. We have a barrage of things we can help out with: sacral and kind of coccygeal pain. Laser is super effective at that. Dry needling in some situations is very potent as well. And then overall, just the adjustment. I know it sounds a little cliche, but just making sure everything is mobile and moving the way it needs to is also very important at helping reduce some of that sacral pain. The biggest thing, though, that you can do at home is to limit the amount of time you're sitting. So when you sit, you're putting everything above your torso. All that weight you're putting straight through the lower portion of your spine, and over time that could be that can exacerbate some of that discomfort. So be wary of that.
So your lovely chiropractor can help.
It can. We can. Yep.
Beautiful. Okay. What is the best sleeping position to avoid back pain?
Ooh. It's a tricky one. It's a loaded one. It's a loaded question. Avoid back pain. Sleeping doesn't inherently cause back pain unless you're like sleeping on jagged rocks and,
Caveman
I don't know
style.
exactly. Mm-hmm. But there are preferred positions you sleep in. The biggest one to avoid would be sleeping on your stomach. That puts the most stress on your low back and your neck. So you have two types of curves in your spine. You have primary and secondary. Primary curves are your lordosis, secondary curves are your kyphosis. So your neck and your low back have lordoses. Mid back is your kyphoses. So when you're laying, you're actually putting more of a lordotic curve in your low back, which puts more stress on the joints back there. And then for the neck, you're obviously not going to be sleeping straight on into the bed. Your head's going to be cocked to the side one way, and that puts a tremendous amount of stress on the joints of your neck as well. So try to avoid sleeping on your stomach. Side sleeping's cool. We're cool with that. If you wake up and you feel like you have a lot of glue or like kind of side of your hip discomfort, toss a pillow in there to get the hips and the femurs lined up pretty parallel with each other. It'll take a lot of stress off that area as well. But I guess the classic answer is on your back, sleep on your back. But I don't do that. I'm a side sleeper. Back sleeping's hard.
I'm a side sleeper.
But if you do get some discomfort sleeping with your back, try tossing a pillow up on your knees a little bit as well. That can kind of take some relief off that area too. So back sleeping, side sleeping. Avoid stomach sleeping. Yeah, don't do that.
All right. What is the difference between a chiropractor and a physical therapist?
The tale as old as time. To keep it short and sweet, the biggest difference is chiropractors are specialists in manipulation. So the hands-on, the crack, the pop, the adjust, and then PTs really focus in on pre and post-op sort of rehabilitation. So a lot of PT positions you're going to see are integrated within a hospital setting or in relation to that. So they see a lot of people, post total knee, total hip, total shoulder, stuff like that. They see a lot of that stuff. Not saying they don't see your out of the norm. You know, some bodybuilder comes in with like some pec discomfort, stuff like that, and they work on form and technique and stuff. But a vast majority of what PTs see are coming either pre or post surgical care, and not many of them manipulate. So I guess that would be the biggest difference.
Chiropractors are cool. They can do both.
We do both. We don't see very many pre and post op though. We see, what would you say we see, Kaylee?
Well, sometimes they come with scripts for primaries to do exercises on the floor, some more like rehab based.
Yeah. So a lot of people that decide to go see their primary first, when it comes to like, you know, neck, shoulder, low back pain, that's not surgical, traumatic, stuff like that, they'll bring in a script from their doc saying, hey, run this patient through a trial of physical therapy for their low back or their shoulder and stuff like that. So we see a good handful of that. Yeah.
How can a chiropractor help to relieve a pain from a pinched nerve?
You'll learn about that soon, Kaylee.
No!
Pinched nerves. I really don't like using the terminology pinched. It's very old school in my mind. Nerves can get irritated quite frequently in the spinal area. So when we talked about pinched nerve or like sciatic and stuff like that, most often than not, the problem is spinal related. So when it comes to pinched nerves, it's really never pinched in the like classic sense, you know what I'm saying, Kaylee? A lot of the pain that you feel from a pinched nerve is due to a chemical called histamine in the inflammatory process. So when you injure your back, you bulge, you herniate, you dissect a disc, your body responds with a huge inflammatory response. And that's a chemical component that plays a huge role in irritating nerves. So how can you help manage it? Is that the question?
How can you help relieve it?
Cool.
Yeah.
So myself as a chiropractor and all the other docs in the office, we have a multitude of things we do. Of course, you know, the adjustment's gonna help. Passive stuff that we really like right now is dry needling and laser. Those are both very potent ways of helping reducing pain and kind of controlling that threshold of how severe it is that the patient is perceiving. And we followed up with some sort of corrective or functional movement that's allowing the patient to move more readily without pain and to move appropriately. That way, we're educating them how to move in the future so they don't come back into the office with the same issue.
Makes sense.
Yeah.
That makes sense. I guess the last lovely question is, do women get lower back pain more often than men?
Yes, they do. So there's a couple, I'm trying to think how I want to structure this. There's a couple ways, or I guess a couple different reasons why females will report more low back pain than males. So reporting, men don't like to admit they're in pain. That's the simple truth.
True.
Unless it's like they're 10 out of 10, they gotta go to the hospital. They'll just work through it, you know, I'll push through it, it'll be done in a couple days. So women are more likely to report having instances of low back pain, which that kind of skews the literature right now. But also women are, I think current literature right now is 6 to 10 times more likely to develop or to have a connective soft tissue disorder. So that's going to be your POTS, your Ehlers-Danlos, stuff like that. And it's musculoskeletal in nature as well. So that leads them to a higher risk of some sort of spinal pain, predominantly low back pain. Women also give birth, you know, go through that birthing process of carrying a child. That excess weight also stresses, like I said earlier, that lordosis of the low back. So, you know, that they bring on a lot more stuff than what men do statistically in their lifetime. Outside of that, you know, that's a good kind of insight as to why females get it more than men.
Interesting.
Oh my gosh. You made it so long without saying it.
I just wanted to say it.
Guys, if you have any more questions that you want to have answered, feel free to leave them down below, and we'll catch you in the next one.